Bogle Gomez, licensed midwife.
Thanks for having me, Latoya. Thank you.
Yes, yes. And Miss Charlene has been trained in the beautiful country of Jamaica. So
Yes.
here we have our Jamaican trained midwife is going to tell us, and she also works in Bermuda. So she's classically international now. So she's going to
That's
tell
right.
us about her experience and what it's like being a midwife, trained in Jamaica, living in Bermuda, being a migrant nurse. And she's going to tell us all about midwifery. Let us learn about midwifery today and love it. Charlene, so
Hi, Latoya. Hi, viewers. So I am in an awesome job, Latoya. I must
Mhm.
start from the beginning.
Yes.
From I was in high school, and we are going to different classes. I know
Mhm.
you're just meeting the teachers, and as young students, you have to stand and say, "Hi, my name is Charlene Bogle, and in the future, I would like to become a registered midwife and a part-time fashion designer. I can't design anything, but I pursued my midwifery dream, and I am
Awesome.
loving it. Girl, no other job.
Beautiful.
I love my job, honestly.
Beautiful.
For me, though, for being a midwife in Jamaica, there's a difference with being a midwife in Jamaica and being a midwife here.
Okay.
Jamaica, the midwives have a lot more autonomy, but
Okay.
here it's obstetric led. So the
Okay.
doctors are the one that does the actual deliveries here. But if
Okay.
the doctor misses it, we are all trained on the maternity ward as midwives, so we can do the deliveries. But it's
Okay.
a really, really awesome job. We still have some form of autonomy here, but it's not
Mhm.
as much as when we were in Jamaica.
Okay.
All right.
So if it is, I have a nurse that wants to be a midwife. How long is the training process? And do you have to be a registered nurse before you become a midwife, or you can do it straight?
All right, so definitely you do not have to be a registered nurse. I was a registered
Okay.
midwife before I became a registered nurse.
Okay.
So I was really happy to hear that the midwifery school in Jamaica was sending out applications for those who want to be, and I applied and I got through. So my training to be a what they call it is a direct entry midwife, and you go for training for 2 years.
Okay. Okay.
But if you are a registered nurse before and then
Mhm.
you want to do the midwifery program, then it's just 1 year.
Okay. Okay. And
Mhm.
I know in Trinidad and Tobago they do 18 months. Those who are
Okay.
registered nurses, yeah, they do 18 months to do the midwifery program. Okay,
But
that's
what do they get?
awesome.
Certificate?
Hmm?
What do they get? Certificate after?
Yeah, I believe it's a certificate they graduate with. Yes. Yeah.
Okay.
Yeah.
Interesting.
That is
Yeah.
actually educated. I didn't know that. This is the first time I'm actually hearing this. I didn't know that. Okay.
Mm-hmm.
So you told us about your love of midwifery. You told us about your journey that you know you was in high school. You knew you wanted to be a midwife. That is so awesome. You know, not much
Definitely.
people tell you that they had a dream from young to become a nurse or a midwife or ICU or emergency nurse. But to meet somebody that actually had it from that young. So it's
Yeah.
like you actually self-actualized the day you became a midwife. You understand? So that's
Mm-hmm.
awesome.
Trust me.
So
Yeah.
it's like so do you guys like assist the doctors? Well, I know in Bermuda you said that they do the main things and you guys basically there to catch on if they miss something. So in Jamaica, what it's like is that we come into the hospital in Jamaica and you guys deliver the baby and then the doctor check on us, or is it how does it go?
All right. So when you come into the hospital, at the hospital where I was working in Jamaica, so you're assessed by the midwives first. So you're admitted, you're assessed, and then you have an assessment by the doctor. So you're being constantly
Okay.
monitored by the midwives. So the
Okay.
doctor makes the order and say if anything needs to be made, then go ahead. When it's time for you to deliver the baby, to try and if you have any problems, high risk pregnancies, anybody need a C-section, of course, a midwife does not do a C-section. The
Yes.
midwife can only assist by being the scrub nurse or the circulating while the C-section is going on, but not the actual delivery. All vaginal deliveries we do what we call episiotomy, which is basically making a cut
Mm.
in the vagina to widen the
Open the
space so the
veins.
baby can come out. We're free to do that. We are not allowed to repair it, But if the woman gets a natural tear on her own, which is a laceration, we are allowed to repair that. But not here in Bermuda. Any episiotomy, any cut, any tear, the doctors are the one. The obstetricians are the one that does the repair tear.
But in the Caribbean, you guys have that autonomy that you guys can fix that.
Yes.
Awesome. That is awesome. Okay.
Yeah.
So what is like the patient to nurse ratio for a midwife? How much
Oh,
patient
yeah.
is a standard for you guys? Like what were you trained? Like I know the school tell you one thing, and when you go to the hospital, we experience another thing. So
Oh,
what are the
girl.
two differences? Like what is it in school and in reality?
You're so right about that. Tell you in school, when you actually go on the job and experiencing the things for yourself, it is nothing like that. That's all. Yeah, I can tell you. What the school says, I think maybe it's about 3 or 4 patients you should have. But if it's laboring patient, you should have 1-to-1, especially if the person is going to get like an epidural. So you have to be constantly monitoring the person. You know, I'll never forget, and this is a experience that stands out in my mind. I remember one day back home, long before I came to Bermuda, back in Jamaica, I was on the labor room and we were very short. Our labor room has 5 beds, different beds, but we are separated by curtains. It's not wall. So I
Okay.
was the only midwife in that labor room. And I'll tell you that night, all beds were occupied.
Wow.
And one person had baby. I had to just take my gloves off, put the baby up. Before I take my gloves off, put the baby on the mommy's chest and say, Mommy, your baby's born at that time. Please remember that for me. Run to another one. And you know, one more
Wow.
patient coming and I had no more bed. That's why I had to make do. You know, I had to push 2 sheets on the floor and deliver that baby. Man, it was a matter. But it taught me. It taught me. You had to be bouncing, balancing all over. And trust me, they were all quite comfortable and they saw what was going on. They're like, nurse, how you do that? I'm like, as long as you guys work with me, we'll be all good. And it was an awesome experience. I'll
Wow.
never forget
That is wow. That is
that. Trust
like, yeah. Some people might have freaked out and be like, I can't do this and complain, but you actually your critical thinking skills came into action and you did what you had to do. Yeah,
Have to.
awesome.
Have to,
That's
girl.
awesome. That's very impressive. So you can
Yes,
work
sometimes.
emergency because you seem to be
Yes.
able to function in emergencies very well. So at
Yeah, I love it.
troubleshooting, coming a little
hmm
bit. Yeah.
hmm
Okay.
I do. But here in Bermuda, though, it's really like 3 to 4, maximum 5 patients you will get per nurse.
Uh-huh.
But of course, on labor room, it's always 1-to-1. But
Okay.
here in Bermuda, it's not always 1-to-1 for us. It's
Okay.
1-to-1 when the patient's in labor, but sometimes you have person coming in for a fetal monitoring called non-stress test. So we have to be juggling between our labor and patients and the patient with non-stress test or somebody that comes in to do a little minor procedure or injection or something. So we have to learn to juggle. And we ask each other, I leave in that patient, keep an eye for me, I soon come back. And you have to juggle. So we have to know to work with each other and
Yeah.
know how to get things done. But
Yes.
it's good.
Okay, okay. Well, I know
Mm.
that in nursing, in the whole fraternity of nursing, we all have something that we wish somebody did tell us before we came into it. So is there anything that you could say, one thing that you could tell yourself, I wish somebody told me this before I became a midwife, that it will pass on as knowledge to the future aspiring midwives? What
You
is
know,
it?
maybe nothing readily comes to mind, to be honest.
Okay, that's
Nothing,
good.
nothing. Maybe one thing. Probably somebody should tell me, go and have your own child before you come into midwifery.
Why would you say that? It makes you being around the babies makes you want babies. That's what it is.
Not only that, but what you have to go through to have this baby, it goes in quite easily, but it comes out kind of hard, you know.
It comes out kind
So
of.
I should have experienced all of that first. I said, okay, yeah. But it's
I
really
like that
interesting
word.
though.
It goes in kind of easy, but it comes out kind of hard.
Yeah, it's pain. And what people don't understand, it is called labor for a reason.
That
You
is
are
true.
laboring, you're working, you're gonna feel
Yeah,
pain. And
yeah,
remember, this is from Adam and Eve and in the Bible, and when Eve ate the apple and gave Adam, and then of course,
yeah.
you know, Eve
And
got
then
the
all
curse
of
and
us had
said,
to get through this pain. All of us get
in,
it.
in pain you shall bring forth. And that's what we're doing. But you know,
Yeah.
talking about the Bible though, you know that the midwives are mentioned in the Bible?
No, I didn't know that.
You didn't know that?
Really?
So
No, I didn't know that.
there are different areas in the Bible where the word that God spoke about the midwives. And that's
Ooh,
how blessed they are. Yeah.
so you are a
So
blessed job. Yes.
yeah. So there are two main midwives in the book of Exodus, chapter 1, verse 15 to 21, where there were
Uh-huh.
two main midwives that normally deliver the Hebrew babies, and they're Shipra and Puah. So
Okay.
Pharaoh wanted those two midwives to kill all the Hebrew boys because
Oh
he
yes,
was trying
I
to
remember
cut
that
off.
story. Yes, I didn't remember. I now remember it. Yes.
So they should let the girls live and all the
Uh-huh.
boys should die. Once they're born, once a baby
Yes.
born and they realize the boy, they should kill them. But they disobeyed Pharaoh because they didn't want to kill them. And God blessed them and said that made them blessed and made them have their own families and stuff. So, and there are different
Yes.
areas in the Bible that talks about midwife.
That is awesome. That is good
Mhm.
information. I never realized. I have read the Bible, but that I have never really see, like, like how you're talking about it now. I like, yes, I heard this story before. That's
Mhm.
true.
Yeah.
Yeah. That's awesome. Yes, that's a nice thing. That's a nice thing. Wow. You have me thinking now, like, wow.
You need to do midwifery. Yeah. You ever thought about doing midwifery?
Yes, actually, I wanted to be a midwife in 2010, but in
Right.
Trinidad and Tobago, the bureaucracy was ridiculous. It was horrible.
Understand.
Yeah,
Mm.
it didn't work in my favor at all. And hopefully, the midwifery and nursing fraternity, hopefully, we move forward and stop having the bureaucracy and open up these specializations, because
Yeah.
this specialty of midwifery is awesome. I know that. When
Yeah.
I speak to any midwife, they will tell you they love their jobs, and
Mm-hmm.
especially the fact that you are there seeing life come into this world, brand new life. It's
Yeah.
amazing. Whereas
Mm-hmm.
I work on the opposite end of what you do. I work
Mm-hmm.
on the
Instant.
side where people die mostly. That's what I deal with. So I think after a while, the dealing with the part of the section that I deal with, the sickness and the sadness, it gets toxic. It begins
Yeah.
to make you feel overwhelmed. And I think
Mm.
that's part of the reason why some of our colleagues getting burnout, that experience. And talking about burnout, do you guys feel burnout? Because I know you guys love your job and all of that. But
Mm-hmm.
midwives, do you have anybody that you like within yourself? Do you feel like you don't want to do it anymore? Have you ever been in that moment where you felt like I don't want to do this anymore? I think I need a change. I think I need to leave this. I need to do something else. I need to do something else. Have you ever felt like that?
Me personally, no, I'm not at that stage at all. But I've heard coworkers who
Yeah,
feel like, hey, I think this is enough.
this is
20
enough.
or 30 odd years of this. I think it's time
Mhm.
to either retirement. They're looking, okay, how soon can I retire? Or is there something else I can do until retirement? But me
Okay.
personally, I'm definitely not at that stage. No,
Okay.
no.
So what would
Mm.
you think would be in midwifery section, what would you think would be the thing that would cause burnout? Because I had a whole episode about burnout with regards to nurses on a general, but I'm talking about in your specialty. What do you think you see as things that could cause your colleagues and yourself to be feeling that feeling eventually, like, burnout syndrome?
Well, I guess things that would cause us to feel burned out is if we have to continuously work continuous hours, the place is short for
Yeah.
whatever reason, whether it be persons are out already sick or persons
Mm-hmm.
are on vacation. And then
Mm-hmm.
recently they had changed our working line and took out two nurses out of it. So some
Yeah.
of us are there a little more frequent than others.
Yeah.
And it causes some time, but thank God for the few days off that we have. So we try to rejuvenate and refresh and revive ourselves in order to approach work again. So
Awesome.
we're burned out to an extent, but it depends on how many persons are out. That's when it really affects us more.
Awesome, awesome. Okay, great,
Mhm.
great. That's good because, as I said, I haven't really heard much midwives complain about feeling like that. I mostly
Mhm.
hear the bedside med surge nurses talk about that, ICU nurses,
Mhm.
emergency. Because I think, as I said, I think it's because of the environment we are in. We don't
Mhm.
feel guilty because seeing a baby born is awesome. It's like you'll feel this beautiful, warm feeling.
Trust me.
Whereas
Yeah.
when you see somebody blood pouring, stuff happening, you're not gonna feel that. You're not gonna
Mhm.
feel
Mhm.
that, beautiful, warm feeling within you. Okay, so
Yeah.
that's awesome. I like you actually make me feel like, wow, midwifery is awesome. I should promote midwifery some
It
more.
is.
Yes,
It is.
yes,
It
it really
definitely
is.
is.
And teeny babies are awesome because seeing babies is always a nice thing. Always.
Mhm. And, it's so funny to see their little personalities just budding out from day one, from they're just
Yes.
born. You have an idea. Oh, well, yes, are they going to be that type, this type? They're looking at you, you're talking, and it is so awesome. I was watching them and say, I'd love to see you later on when you're older. Oh
Uh-huh.
my God. It's really
That is
nice though.
beautiful. That is beautiful.
Mhm.
So, is there
Yeah.
anything you would like to tell the nursing fraternity or our nursing colleagues as a licensed midwife? Of how much years? I know it's over a decade you've been a licensed midwife. So, what would you like to give them as advice? Seeing that we have so many nurses today want to leave the job, want to walk away from nursing, what would be your advice to us before we go?
To be honest, I just think that person should do the job because they love it. So if it's not something that you love, doing it for the money alone won't cut it. Yes, the money is going to sweet you, but it's sweet you for a time. Because if there's no true love for what you're doing, Latoya, then it's going to feel like a drag. It's not going to feel like, hey, I'm going to do this. I need to do this. I'm doing it because this is what I want to do. So for me personally, since I ended up being a midwife before I became a registered nurse, I didn't want to be a registered nurse. But I realized in order to move up the ladder, I couldn't just be a straight midwife alone. I
Midwife.
had to do my general nursing
Yeah.
program in order to be up. So I am both
Mm-hmm.
a registered nurse, registered midwife.
Mm-hmm.
So for persons, I mean, it's all well and done. We're all working for money. That's the long and short of it. Because if we didn't want the money, we would not be working. That is the
Yeah.
long and short of it. But on a whole, though, I think persons should do it from their heart. I think
Yeah.
when they do it from your heart and you reap the real reward, so even if it's not just financially, but you get a certain type of blessing by caring for people on a whole. You're
Yeah.
caring for them, and when persons really turn around and say, "Nurse, thank you," it really feels good, you know. Even if I'm not looking after a mother, because I've
Mm-hmm.
worked on other wards, geriatric wards, and when
Mm-hmm.
nurses, the patients look at me and they say, "Nurse, thank you," it feels good.
Yes, it does.
It feels really good.
Yes. Patient recognition is awesome for us. It makes us feel like what we are doing is, it make a difference. It meant
It
something.
does.
Yeah,
It does.
it really
But
does.
as you talk about telling the nurses thank you, like here in Bermuda, there are some persons called doulas. I've never met a doula in Jamaica. I didn't know what a doula is. So when I came in, I heard about doulas. And then when I see these women who are there for the mothers when they're coming to the labor, yes, I see them giving them back massages, or they're giving them rubs, or they're talking, doing some form of exercise, or listening to music and dim the lights and just being the support person apart from the partner that's there. But the midwife who is there to give the medical care that the doula does not do, it also helps. So
Mm-hmm.
yes, some patients tend to be more lenient looking towards a doula for the advice and what to do and what decision to make. You ask them a question, "Mommy, do you want something for pain? What would you like?" You're looking at the doula. We're like, "Okay, you're the one in pain.
So let
You
me
need to
ask
tell me
this
what you
question.
want."
Let me ask
It,
this question. What is a doula? Because you bring it up. Yes. What is a doula? I'm confused. Like, because why will I look at the doula over my nurse? It's like she is qualified. What is a doula? What is a where do they come from? What is it? I don't know.
no, a doula is someone who's there to support a woman during labor, in the pregnancy, during labor, and after, for the first few days after she gave birth, right? So she's really there for emotional support and physical support, and she gives them some form of information, but she's not a medically trained person like the midwife.
Oh, okay.
A doula cannot deliver a baby, but she can
So
be there to assist.
so a doula is like you're having labor and your sister is there with you and she's there to hold your hand and talk
Yes,
to you. So it's like
yes,
you have a sister, a paid sister to be there with you or a mom
yes,
or
that's her
something.
job.
Okay,
Hmm.
okay. All
It's
right.
something that a family member could do, but she has a little more knowledge because she try and study stuff and see how to make you comfortable while you're going through your labor process.
So she's there
So
to
she knows,
provide comfort, basically,
yes,
emotional comfort, physical comfort to the best of her ability, which would be a layman, as we call it. Yeah?
yes, exactly, exactly.
Okay.
So the
Okay.
difference between the midwife and the doula, there's a difference in the training, difference in the duties that we have, and definitely difference in the certifications.
That is wow. So I can imagine like you are having a laboring patient, you're telling them to do something and they're looking at the doula for answer. It's like
It,
that's kind of like that's so wrong. No, that's
it
that's
happens all the
wrong.
time. It happens all the
Yeah.
time. But in my head, I'm not offended because I think because they met the doulas before. So these are persons that they've been talking to. So they build a certain relationship with them. They're coming to the hospital to have baby and they've never met me.
Yes,
They don't
yes,
know.
yes.
All they
So
know is
I
I'm the nurse
understand.
or I'm the midwife, I'm there. But because you have a relationship with your doula, you tend to want to ask your doula, but
Yes.
I'm the person that is medically trained and know
Yes.
exactly what to do. I have no problem you discussing it with your doula and both of you decide, okay, I want this, do I not want that? But when I see it's going to impede your medical care, that's the part that I'm not too fancy about. Because if I
Okay.
see that the baby heartbeat is going down, or if something is happening and you need to get something, and I ask you, but because in your head and because you're the doula say, no, we don't want it. Come on, the common sense. So what I do a lot of teaching, When I have a pregnant woman, I explain everything. Everything I'm doing to them, I explain. I'm doing this because, and this is happening to you, and I because that's what I would want somebody to do for me if I'm the one
Yes.
on the bed. Because
Yes.
it could be me, could be my mother, could be my sister, could be anybody for me. So the fact that I'm straight out tell you what's happening. And to be honest, I see that a lot of my patients love me. I have no issue with my patients because I just tell them, hey, I need to do this, but I don't want to force. Everybody has the right to refuse. But if
Yes.
I see that you refusing going to cause something to happen to your baby or to you, I'm going to still talk to your mommy. Are you sure this is the benefit of it? You need to have it. You need to this. And some of them, most of them, they always say, all right, nurse, give me a little time before I do it. But if there's not enough time because something's going to happen, I will explain again. But if not, most of them, they just end up accepting and say, you know what, anything to get my baby out alive and well.
Okay. That's good. And as I say, teaching and having a nurse to, to give you that feeling. I have been a patient on the maternity ward, and I can say having a nurse that is caring, having a nurse that is actually trying to interact with you and speaking to you when you're asking questions, not getting agitated, is a big deal. Because my experience, I had one nurse, I could call her name, I'm sure she wouldn't mind, Nurse
Yeah.
Andrea. She is like, she's staying in my mind because she had, I felt as if she saved my life. That is how I felt. She saved my life. And I will always be very grateful to her. And it was her approach, it was her, the way she was talking to me, it was the way she took
Mhm.
over the situation. Just like you, the emergency, she was on the button. So I
Yeah.
realized that it really is a passion, and it really takes a specific type of person to
Mhm.
want to have this job and be able to excel at it. Because
Mhm.
it have some people, no, they just no, they just no. And yeah, there are the others that that will stand out, right? Because
Yes.
I know you
Mhm.
personally, and you have a standout nursing care. You give that, so I know that you are one of those. But there are some of them that we, as our colleagues, we need to let them know. You need to pull up yourself a little bit. You need to pull up your
Yeah.
socks a little bit. Have a little better,
Mhm.
have more standard in what you are doing, because we need to have a once they come and they talk about midwives, they must know, yes, I love my
Mhm.
midwife. We want to hear our patients start back saying these things. I love my midwives. I'm not saying to do away with the doula system, because it might help, because it might
Yeah.
help
Yeah.
somebody more personal. But
Mhm.
I want the world to start back loving our midwives. I want, when you see a midwife, you must be like, yes, I know I could be comfortable. My nurse is gonna take care of me. That is something that we should aspire for. And I'm very happy for you talking with me this evening. I'm very grateful and thankful. And
Same
thanks
here.
for making me feel the love of midwifery again.
No problem. Sure. Of
And
course.
I hope that our colleagues and all the aspiring midwives hear your story and understand that, yes, you have to have a passion for it, and you have to want to do it, and you have to put yourself in that mindset all the time. And remember, you are responsible for somebody with a little human inside of them. So
Yep.
it's not just mommy alone, it's mommy and
Mhm.
baby.